Hi, Assalamualaikum. My name is Siti Atiqah binti Mohamat Helmee. I am from BA 1185M.
Assalamualaikum. My name is Ingish binti Indra Kasuma and I'm from BA 1185M.
Hi, Assalamualaikum. My name is Anisya Nabihah binti Akmaluddin. I'm from BA 1185M.
Hi, my name is Siti Farhana Affandi and you may call me Farhana or Hana, and I am from class BA 1185M.
Hi, Assalamualaikum. My name is Mohamat alias and I'm from BA 1185M. So now let's start with our presentation.
Today's topic is dengue. What is dengue? Dengue is an acute infectious disease that is characterized by severe headache, joint pain, and rashes that is caused by a single-stranded RNA virus of the genus or species dengue virus. It is transmitted by mosquitoes of the genus, and in the Actis it is also called as breakbone fever, dengue fever, or dengue fever. Causes of dengue. The viruses that cause dengue fever are spread by mosquitoes of the species Aedes aegypti and sometimes also by Aedes albopictus. Aedes mosquitoes are usually found in urban and suburban areas as they like to breed in man-made containers like tires, flower pots, and household water. Sign and symptoms. So for mild symptoms of dengue usually can be confused with other illnesses such as having fever, nausea or vomiting, rash, and aches or body pain. Meanwhile, for the severe symptom of dengue, you will usually feel stomach pain, nosebleed, vomiting blood, and feeling tired or restless. Other than that, sometimes you could also be having a severe abdominal pain, hepatomegaly, which is an abnormal enlargement of the liver, and postural hypotension, which is a form of low blood pressure. Diagnosis. Now we will look into the diagnosis of dengue. Diagnosing dengue fever can be a little difficult and can be confused with Zika virus, chikungunya, malaria, and typhoid fever. Your doctor will ask for your medical background, travel background, as well as drawing blood sample to be tested. Be sure to be specific and mention any contact with mosquitoes too. That is all for diagnosis. Let's go to the next point. Treatment. There is no specific treatment for dengue except you should drink a lot of fluid, consume coconut water. You also should make sure you take enough bed rest. Other than that, you should include orange in your diet while recovering. Next, the person having dengue should take acetaminophen, which is a medication used to treat pain and fever. Ibuprofen also is not advised to be consumed as they can increase the risk of internal bleeding. And lastly is hospitalization, in which it will allow the individual to be properly monitored in case the symptoms get worse. Can dengue cause death? The answer is yes, dengue can be deadly. Typical dengue is fatal in less than 1% of cases. However, dengue hemorrhagic fever is fatal in 2.5% of cases. If a person does not have enough platelets, they can have dangerous bleeding. This bleeding usually happens in the gastrointestinal tract. When a person has bleeding, leaking plasma, and not enough platelets, they have dengue hemorrhagic fever. hemorrhage means dangerous bleeding. If dengue hemorrhagic fever is not treated, death rates can be as high as 20% to 50%. During week 50, 2020, a total of 795 dengue cases have been reported, bringing the cumulative number of reported cases to 88,074 as of 12 December 2020. It is a decrease compared to 124,777 cases for the same period last year. No dengue deaths were reported in week 50 with a cumulative figure of 141 deaths in 2020 compared to 174 deaths during the same period in 2019. Dengue activity has a decreasing trend since week 33, and the number of cases reported in week 50 is the lowest in 2019 and in 2020. Dengue vaccine globally. Luckily, a vaccine is available. A vaccine to prevent dengue is licensed and available in some countries for people ages 9 to 45 years old. The World Health Organization recommends that the vaccine only be given to persons with confirmed prior dengue virus infection. Prevention. First, you need to wear protective clothing. Wear long sleeves and long pants where possible. Cover up exposed skin so insects have less surface area to attack. Choose light-colored clothing too. They will attract fewer mosquitoes than dark-colored clothing and will keep you cool at the same time. Make sure to wear full-sleeve clothes and long pants when you step out of your homes. Do not leave any part of your skin exposed to mosquito bites. Aedes aegypti typically bite people during the day, so this way can reduce mosquito bites when spending time outdoors. Second, you need to keep your windows closed. During monsoon, dengue fever cases usually increases every year, so it is better to make your house mosquito-free. Keep your doors and windows closed as much as possible to prevent the mosquitoes from entering into your house. People can reduce the risk of mosquitoes entering their homes by using window and door screens or by keeping their doors and windows closed. Next, reducing mosquito habitats. A bottle cap full of water is all it takes to breed mosquitoes. Even the most unassuming objects can hold water and be the source of your mosquito problem. Check your yard for standing water. Dengue causing mosquitoes breed in stagnated water. Keep the area around the house free of any collected water, be it rainwater or drainage water. Waste bottles, old tires, and other stuff where water can collect and stagnate are also excellent breeding places for mosquitoes. Dispose of such things immediately. Look for stagnant water and move the container to remove the water. After that, place container to a dry and roofed place. Next, clear the clogged drains. Clogged drains are among the main causes of dengue outbreaks, which has increased from year to year. Like most diseases, dengue can be prevented, but to prevent it, cleanliness must be diligently practiced by all, and it must start at home. Most dengue cases in areas where rubbish was turned all over in clogged drains, as well as pools of stagnant water where the Aedes aegypti mosquito larvae thrives. And the last thing in prevention of dengue is killing mosquitoes' larvae. Larvicide kills the larvae before they are able to reach into mature age and develops. In Malaysia, the most common product that is endorsed by netizens are Abate larvicides powder. If you are feeling skeptical at the use of chemical product to treat the water, do not fret as there are alternate natural way of doing so. Using household items. Measuring a ratio of 1/8 of apple cider vinegar to water will surely kill all the larvae and still be non-toxic to the environment. A thin layer of oil and dish soap will also do the trick with dealing with those little buggers. But these methods might restrict some use of the waters. Chemical product might seem the better choice as they work fast and last longer.